Okay, welcome back, everyone. I hope my voice is audible. It's clear. Good morning and good evening, some of you, and a very, very happy new year as well. Most of you already talked to me on the Happy New Year as well, but I still need to wish everyone because this is the first lecture of 2026. So, welcome back, everyone. In today's class, we are going to talk about acid-base imbalance. Okay. I'm just waiting for a few more students and I'm going to start the class very, very soon. If you need like pen, pencil, paper, something in your hand, feel free to get it ready because you might need to make some notes at the same time. We are also live on YouTube as well at the same time. So happy New Year to YouTube students as well. Okay, let's get started. If my voice is audible, everything is good. Now we are going to begin the class. So in today's class, as I said, the main topic which we have today is about acid-base imbalance, right? Now, in the next lecture, I'm also going to bring the fluids and electrolyte imbalance, and I will post that information today on the WhatsApp group. You will see with me in there when is going to be the fluids and electrolytes imbalance. And after that, ECG lecture is also left, as I promised earlier. So we need to do that as well. And after that, everyone, we have a plan in this month to do more practice questions. Okay. So stay tuned with me with all the updates in the WhatsApp group. So you will see every time announcements in there. Those who are joining me very, very first time on my platform, just so you know, we have covered so far in the free nursing classes, we have covered so far nursing fundamental. We also covered so far maternity, mental health, and endocrine system, and also the cardiovascular, right? So if you are very new to this platform, watch those all the lectures. And after watching the lectures, if you still have a doubt, any questions, you can always connect with me. And even if someone need like they want to understand something in English or Punjabi, like in Hindi or Punjabi, sorry, you can always connect with me over the WhatsApp. I can explain the topic to you in a very easy language as well. If something you do not understand in today's class or maybe in my other lectures. Now let's get started with the acid-base imbalance. I personally think this is one of the most important topic, not just for the NCLEX or NORCET exams or any other competitive exam, but it's also important for the real life. So I think it's very important to study the acid-base imbalance, right? Now, personally, I think why this is important to study, because first of all, it actually tells you what's wrong in your body, okay? If you understand the basics, you can actually find out when you see your patient, you can find out what's going on in there, right? Because as you know, most of you, the lungs control carbon dioxide, kidneys control the bicarbs, right? And if the one system fails, the pH can be changed very easily. And if the pH is affected, the body will be affected. So you will learn with me in the next slide, how is it going to be affected and how you can find out what's wrong in the patient body, right? The second thing, what I personally think, it also directly affect the patient safety also, even in real life, not just purposes for the examination, but also in the real life also, you know, because even if a small pH is changing, I personally think this can be a very, very life threatening. Because if your patient body goes down, the acidosis will be there. That means the cardiac output will be down. The patient can have either arrhythmia or even the low blood pressure and some other symptoms too, right? We will also talk about in the next slides also, but this is just the overview. Why is it important to study, right? Similarly, if your patient have alkalosis, the patient can go into confusion stage, can also have seizures, right? And even in the severe imbalance, doesn't matter in acidosis or alkalosis, your patient can actually go into coma or death. So if you do not know this as a nurse, this could be harder for you, then it will be harder for you to save someone's life. That is why I think this is very important topic to study, not just for your examinations, also when you practically dealing with your patients on the floor. The third thing what I feel like is, if you have a good understanding about this topic, you can easily know what nursing interventions you need to do with your patient, right? Like, do you really need to give the oxygen? Just the oxygen is enough, or should I consider this patient on ventilator support now? Or IV fluids, or maybe soda bicarb, right? Do I need to give insulin or not in DKA? When do I have to notify the doctor as a first nursing action, right? So you can only know this thing if you have a little bit knowledge about the acid-base imbalance, because without this knowledge, the actions can be very dangerous, right? You can only perform the actions on the time if you do have a little bit knowledge about them. Now, the last thing what I feel like, definitely for your exam also, this topic is very important. Sometimes, they are not just testing you like, okay, how do you find out, is this the metabolic acidosis or alkalosis or respiratory acidosis or alkalosis? It's not just about that, right? Sometimes the NCLEX is checking your critical thinking skills, even if you really know as a nurse what to do first in that case, right? Do you really know some engine style question, how to handle it? So these things can also come in the engine style too. If you're writing down the NCLEX exam, even the select all the reply type of questions as well, right? And sometimes I notice they're asking you these questions in the form of the diagnosis also, like DKA, very common. COPD is very common. Anxiety patient, if you have, they can also ask you those questions in the form of anxiety patients too, or maybe someone just threw up in your case scenario, like a vomiting scenario, right? So these are just the common examples, but I think this is one of the frequently tested one of the topic in the NCLEX, especially if you're writing down the NCLEX. And even the NORCET students, if they're looking at this lecture right now, this is one of the most important topics for your examination as well, right? So you really need to know the basics about it, and you really need to know how to eliminate the wrong options fast if you have a basic knowledge about this one, right? Now, the last thing I already highlighted here in the red color as well. Remember, the acid-base imbalance is basically the language of the body, right? As I said, it basically tells you when your body is going to be in the crisis. So if you really understand today in this class about the basic concept, you will automatically know what's wrong with the patient body, why is it happening in there, and what are you going to do as a next as a nurse as well, right? So that is why we are bringing this class here today, so you can know about this information, right? Now, the first step, which I personally feel, which every nurse needs to know before she do anything into the acid-base imbalance, she needs to know about some normal values, right? Or he needs to know about the normal values, right? So the normal values, if you see on the right side of the screen, right? The pH is always 7.35 to 7.45. Everyone remember that by heart, this value, always, 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 right? Doesn't matter your exams is giving you normal values or not in your question, you still need to remember them to save someone life on the floor. And even the bicarbs is 22 to 26. Now, I want to highlight it bicarbs a little bit, because some books, you will see some textbooks, they will tell you 26, 22 to 28 as well. And some books will tell you 22 to 26. I personally think if you're going for the competitive exams, Usually until 28 is okay to consider it, right? But you're also going to look at the carbon dioxide value at the same time in the question, what is happening in there, right? So you will see some MCQ examples with me in the next few pages, and you will see with me how to apply these normal values and how do we find out the right answer, what's going on in there, right? The next one we have carbon dioxide, right? PaCO₂. The PaCO₂ basically is 35 to 45 always in every textbooks as well. So you're always going to consider the same value in here, okay? Now, everybody knows the pH goes down, we called it acidosis. The pH goes higher, we called it alkalosis. Okay, those who are learning from the very beginning, they don't know anything about acid base imbalance. I want to let them know pH down we call acidosis, pH up we call it alkalosis, right? Now, once you know this basic information, let's get started with the first step or the first type of the concept which you need to know in the acid base imbalance, right? The first concept is about how do you identify, if your patient is in metabolic stage or in the respiratory condition right now, or is it something acidosis, is it alkalosis, right? How do you know basically all those things? So to identify this, I think this is one of the easiest formula. Some nurses, they already know the formula about the Rome, right? If you think Rome is working good with you, you can go with that as well, right? Like respiratory opposite, metabolic equal. But if you think Rome does not work with you, then this is something an alternative option if you want to look into this, right? So basically the first formula I have here to remember is the pH always follow the bicarb, right? What does it mean? The pH always go with the bicarb. Means if your pH is on the higher side and the bicarb is also on the higher side, that means both are either on higher side or maybe both are on the lower side, right? So either both are down, either both are up. If you see the slide back again very clearly, either both are on the higher side, either both are on the lower side. It has to be same together in the same direction. So when it's going to be in the same direction like that, we always call this is a metabolic condition. This is not a respiratory condition, first of all, okay? Either both are up, either both are down, we always call is the metabolic condition. This is very simple, easy way to remember and recognize it first. And definitely if they are not opposite in the same side together, right? So let's say, for example, if the pH is up, bicarbs is down, or maybe pH is down, bicarbs is up, then we called what condition? Respiratory. Means they are opposite, right? So that means if your arrows are opposite, you only look pH and bicarb. First of all, only bicarb and pH. No carbon dioxide in the first step, okay? So in the first step, pH and bicarb, when you look at them together, if they are both above or if they are both down, we call back again, this is the metabolic. But if the one of them is on the upside, one of them is the lower side, doesn't matter which one out of it, we call that condition is the respiratory. Very simple, not very complicated. Let's use this formula in a simple questions here so you can find out the right answer with me. Now, you can also participate at the same time in the comment sections, up, down, if you want to write it down, right? Or if you want to write down your own right answers. You have a doubts and question, Zoom students, they can always type down in the Zoom link for me. And the YouTube students, they can always type in the YouTube chat box as well. Now, if you see the first one, excuse me, the first one we have is the pH is 7.30, right? 7.30. So 7.30 is up or is it down? You will be like, this is down, then the normal value, right? And then when you look at the bicarbs now, the bicarbs we have here is 18. This is also down at the same time. Are they both in the same direction? Yes, they both are in the same direction. Then what do we call this? We call this metabolic. Now, how do you know this is acidosis or this is alkalosis? For that, you always look at the pH of the patient. If the pH is now in the acidosis stage, we're going to call it metabolic acidosis. But if the pH is on the upper side, we always call it the alkalosis, right? So first of all, you look if it's metabolic or if it's respiratory. That is the first step. And once you know if it's metabolic or respiratory, the second step, you always look for the acidosis or alkalosis. So in the first step we have is the metabolic acidosis. I hope everybody understands so far. This is not very complicated. Let's try another example with me here. Very similar, right? And let's do this question together. It says 7.48. This is on the down or at the upper side? You will be like, this is on the upper side, on the up, right? So it's more than the normal value. Then you look at the bicarbs again. This is 30, right? So again, this is on the upper side. If they both are in the same direction now again, right? They both are in same direction. They both are on the upper side. Again, we call this condition is metabolic. But this time this is going to be alkalosis. Why alkalosis? Because your pH is on the higher side. That is why we call it the metabolic alkalosis. I hope everybody understanding so far. It's not very complicated back again. Now let me give you one question and you tell me the answer for that question as well. Okay. So what about if I give you the pH now, everyone, if I give you another new question, the pH, I write it down. I give you 7.28. Okay. 7.28. And the bicarbs, I give you what? Bicarbs, I give you 20. Sorry, not the 20. This is 7.28, so this is down, right? The bicarbs, I will give you probably around maybe 27, right? 27. So 27 bicarb, you will be like, this is pretty close to the normal, but this is on the upper side at the same time, right? So this is on the downside, this is on the upper side. What do we call this? Are they both in same direction? No, they are not in the same direction. So what do we call this? Metabolic or respiratory? We're gonna call this respiratory, right? But is this the respiratory acidosis or is this the respiratory alkalosis? You look at the pH back again, you will be like 7.28 means down. That means this is your respiratory acidosis. I will discuss in the next slide very soon about compensated, non-compensated, partially compensated as well. So wait for that concept, everyone. Right now in the first page, we only gonna try to understand about respiratory or is it metabolic? How do we know this is acidosis or how do we know this is alkalosis? So this is a very first step, right? Once you know this very first step, then it's easy for you to understand the second thing which I'm going to teach about in the next page. Now let me see your questions, your chat boxes, see if there is any major question for me. I need to address something in here. Okay. Okay, I can see everybody participating so far. Very good. Some students are requesting the Hindi language at the same time. So for them, I just want to request it like the primary lecture on the live lecture right now is going to be in English only. The reason for that, because we have students from different part of the world. Like everybody watching this class from different countries right now. That is why English as a first primary language, so everybody can understand. But definitely, like who needs help in Hindi also, something you don't understand, you write it down, your question and doubt for me on your notebook, and give me a call later on the WhatsApp. I will explain everything to you. Okay? Yeah, no worries. Now let me see the next question on the YouTube also. YouTube students, any doubt, any question for me so far? I don't see any doubt so far on the YouTube and also on this slide as well. Very good. So let's go to the next slide. Seems like everybody understand everything in here. Not complicated, very simple language. I will explain everyone today so you never forget your acid-base imbalance back again. Now, in the second page here, what are we going to discuss? Now, the second step is how do you know which one is uncompensated? How do you know which one is partially? How do you know which one is fully compensated, right? So to understand that concept, right, the first thing we're going to learn about these things in here, then I'll tell you one simple, easy trick at the very end. Okay. So the first thing is uncompensated, right? Let's see, when do we call uncompensated? So uncompensated, remember, when your body, that means the meaning is of the uncompensated is, that means the body has not start fixing the pH, right? How do we know the body has not start fixing the pH yet, right? Means when you look at the patient ABG value, you will see the pH is abnormal there. For example, right now we have this example in the front. This is abnormal value of the pH, right? And then at the same time, you look at the both values, CO2 and the bicarbs also. Okay, both value, when you look at them together, one of them has to be abnormal. One of them, okay, not both, one of them. In uncompensated, one of them has to be abnormal and one of them has to be normal, right? Abnormal doesn't matter up and down. So one of them has to be abnormal, one of them has to be normal. So for example, here I just bring the carbon dioxide at this time, PaCO₂, abnormal in this stage, right? And then I keep the bicarb normal right now in this example, just to show you that this is the uncompensated respiratory. Why respiratory now this one? Because this is, you see, the value is down, the pH, if you apply the previous formula, right? And then the bicarbs is like 24 right now, right? So when you see them, the bicarbs is 24 in this stage and the pH is 7.28. The pH is already down, we can see it. The bicarbs is 24. I would say this is kind of in between, in the middle, of the close to acidosis or close to alkalosis in this stage, right? So I would consider this is a respiratory problem because the carbon dioxide is way too higher. So this is not my metabolic condition, right? So this is uncompensated. This is respiratory. Why uncompensated? Because one of them is abnormal and the pH is already abnormal. That means your body has not started responding yet to correct the pH value at the same time, right? So this is still uncompensated yet in this stage, right? Now, the next thing, if you see here, is the partially compensated. Now, what is the meaning of partially compensated? Partially compensated means the body is trying now a little bit. That is why the word is like partially, trying little bit, but still your pH is abnormal, right? But how do you know the body is trying little bit now and the still pH is the abnormal? If you see another example back again with me, right? The pH here is still abnormal, but now the body is trying here. How do we know the body is trying here? Because both carbon dioxide, the both bicarbs, they are both abnormal in this stage. So when they both are abnormal, that means now they are trying their best to bring back the pH back to the normal. So when they're trying in this way, we call it partially compensated. See, in the uncompensated, one of them was abnormal, but in the partially, both of them will be abnormal, and obviously the pH is still abnormal, does not come back yet, right? So here, when you look at this type of example, right, the pH and the bicarb, they both are in opposite direction. Definitely this is your respiratory for sure, and it's also like too much carbon dioxide is in here, right? So this is your respiratory acidosis because your pH is down. And which one is this? Partially compensated, fully, or uncompensated? This is we call partially. Why partially? Because CO2 and bicarb, they both are abnormal in this stage, and the pH is still abnormal also. So that means they are trying to helping, the kidneys are trying their best to help in this case, but still not enough to bring back to the pH back to the normal yet, right? So that is why we call this is the partially compensated. This is not the fully yet, this is still the partially, right? You can always take these notes from me after the class, right? I'll share this presentation also in the WhatsApp group also. In case you want to leave these notes with you, you want to print these notes with you, it's easy for you to see them, right? Now, definitely it's a revision required little bit, but I'm pretty sure 1-2 times when you do revision, you will be fine. And if you have another doubt back again, you come up with a doubt, even after watching this class, I always say is you can connect with me on the WhatsApp also, right? I was on the vacation for past few days, just coming back today, everyone. So trying my best. I will try my best to get back everybody messages, phone call as soon as I can. Okay. Now, the lastly we have here is the fully compensated. Now, fully compensated, let's look at it first. Then I will look at your doubts if you have anything for me. Okay. So fully compensated means the word indicate fully. That means body has fixed now the pH in here, right? That means you will look the pH is back to the normal in this case, but still both of them CO2, the PaCO₂ and the bicarbs also HCO₃, they both are abnormal. So they both are abnormal, but pH is back again to normal now. That means they solve little bit problem, but not the 100%. Like it's still there definitely, but why is it fully? Because pH back to the normal now, right? So fully compensation has been done the much that they can do it, right? Because they bring back the body to back to the normal pH, right? But it's still something a little bit problem in there because bicarbs and carbon dioxide, they're still out of their normal values, right? So in this case, this one you will see with me. So this is like pH is the 7.38, right? So this is very close to the acidosis. So I will consider this as a down, close to acidosis, but not actual acidosis, but it's close to the acidosis. But bicarbs is on the upper side, right? So they both are in the opposite direction. So again, this is the respiratory, and the acidosis in this case, because it's close to the acidosis, this pH value, right? But it's fully compensated because CO2 and bicarb, they both are the abnormal in this case, right? I hope everyone understand until here, class. It's not too much a big headache today. I know some students, they don't like acid-base imbalance, but we'll try our best to make the class interesting as much as we can, right? Now, if anyone has any question for me, you can let me know in the chat boxes. Please just write down your questions, the doubts, whatever you have. and I will try my best to address your doubts at the same time. Okay. Now, let's see the next part in here. If there is no doubt, no question for me, but you can always stop me in between. Now, the sign and symptoms we have here is the next section to cover, right? That was the first step, right? The first step which we did, like how to find out, acidosis, alkalosis, or respiratory or metabolic. How do we find out is it uncompensated, partially or fully compensated? Now, the next stage, which you're going to learn with me here today, is about the sign and symptoms, right? Now, the easiest method to remember the sign and symptom is, I personally think this is one of the easiest way to remember if you remember this formula. Remember, the formulas are only make it so you can remember the things easily, for a long time, and you can apply in your exams as well, and you can also apply in the real life later on too, right? I personally think this is the easiest method. Like happy pH means happy patient, right? But if the sad pH, that means sick patient in front of you, right? But exception, remember, is the potassium. Potassium is always, always, always opposite, right? What does it mean? Happy pH and happy patient means, that means if your pH is higher, you got a high patient. Lot of happy means it's not like your patient exactly smiling in that case. I know in the diagram your patient is smiling in here, but this is just the example. But the meaning is, like, if you have a high pH, high patient, you will see everything is too fast in the patient and too much irritated in that patient, right? What does it mean? That means when you look at the major symptoms in the patient, you enter inside the patient room, right? If you see the patient is like too much tachycardia, or the patient is trying to breathing fast in front of you, or maybe a patient is having seizures right now, getting more restless, hyper, activity, the irritability, even when you check their muscles, it's like hyperreflexia, like everything is high, high, high. You enter in someone's room, you see something on the higher side, the diarrhea, borborygmi. Borborygmi is nothing. The meaning is like too much vowel sounds, right? Borborygmi. This is just the fancy language, but sometimes NCLEX give you this type of language too. So if you see these words, think about the diarrhea and too much vowel sounds active in there, right? So diarrhea instead of constipation in this patient, because your patient have too much high metabolism in here, right? So high symptoms when you see in someone, you think about higher pH in that case. That means you want to think about the higher pH means you want to think about the alkalosis. You want to think about the alkalosis in that stage. Alkalosis, right? Because everything is on the higher side. So when you enter in someone your room, you see these kind of symptoms is in there, or one of them you see something in there, that means your patient is going into the alkalosis. See, that is why it's important for you to, recognize these acid-base imbalance. So practically, even when you enter in someone room, you can apply for it, right? Now, the potassium here will be opposite side. Remember, that is also comes in the formula, and this is on the opposite side. Now, why this is on the opposite side? Technically, the reason is when your patient go in the higher stage, right? What happen is the hydrogen ions, they basically come out from the cells, right? Those hydrogen ions, they come out from the cells, right? And the potassium actually go inside the cell in that stage. That is why you will see less potassium inside the blood. So patient will go into the hypokalemia rather than go into the hyperkalemia. So the very simple formula to remember is everything is up, up, up in case of the alkalosis except potassium. That means any symptom you will see it on the upper side. Let's say if I ask you like high fever or low fever, you will be like high fever in this case, right? Let's say if I ask you the patient will be having the cool and clammy skin, or do you think the patient will be having more red and warm skin? What do you think? Cool and clammy skin or more red and warm skin? What do you think, everyone, in the chat boxes now? Red and warm, yes, very good. Because the patient is going on the upper side at this time. So any symptom which you think, which you see the questions, you will see everything is on the upper side in that case, not on the lower side, right? Now, the next example we have again here to remember the acidosis, or look at the acidosis symptoms overall as well, right? So in this case, sorry, I think I flipped the screen on the other side, sorry. So in this case, you're going to look at the pH is on the downside, right? And this is your SAD patient and the sick patient, SAD pH or sick patient. This is how you can either remember, or you can remember the pH is down. That means everything slow down, floppy kind of thing in there, right? So any symptom you will see in this patient, everything is on the lower side. So your patient will having the lower heart rate, which is the bradycardia. The patient is slowly breathing, hardly breathing at that time. The patient is in bradypnea. Rather than diarrhea, you will see constipation. You will see absent bowel sounds is in here, no tone inside the muscles as well. Like everything is down, and you will see if this patient is more like into hypothermia, cold and clammy skin also. Like every symptom, what you can see is on the lower side except potassium. Again, potassium will be on the upper side, right? Now here the potassium will come out from the cells and it will go back into the blood, basically. That is why you will see the hyperkalemia in this case, right? So either you remember, I would say, looking into this formula, so you remember everything into the question, if I have to look at the symptom on the upper side or lower side, right? Or the second formula, I write it down at the bottom just in case you need it. You can remember that the patient and pH always goes together, and the potassium always go into the other way, opposite way, right? Patient and pH always go together. If the pH is down, the patient condition is going to be down. If the pH is up, the patient condition is going to be in the upper side as well, except for the potassium. That is the exception in this case. I hope it's still easy. It's not very complicated, right? But you can always bring your doubts and questions for me as well, right? Now, moving on to the next screen quickly. Next is about the causes, right? This one you might want to write it down a little bit for me, just in case you want to write it down, because I leave it a little bit blank in here, so it's easy for everyone to remember. Now, how do we find out the reason? What is the reason of that patient condition right now, right? How do we know the causes? The basic idea, the basic formula to check the patient, the reason behind it or the causes behind it is, you look at these two formulas actually, right? The first formula is, when you enter in the patient room, and you see something is happening to your patient, ask yourself, right? Whatever is happening to the patient right now, is it a lung-related symptom, right? For example, if your patient is not breathing enough right now, ask yourself if it's a lung-related symptom. If your brain says yes, this is a lung-related something happening right now. If you think it's yes, right, it's a lung-related symptom, something happening right now, then this is the respiratory, right? This will give you an idea. When you enter in the patient's room, you are looking at the symptom of the patient, right? And you are like, what's going on in there? If you think that symptom is related to the lung, then think about the respiratory at that time, right? Then the second question, ask in your brain, whatever is happening to the patient right now, is that patient is basically underventilating or over ventilating? I'm just going to write down here under or over, right? Under ventilating or over ventilating. Under ventilating means like patient is like breathing, but not sufficient breathing right now. It's hardly breathing right now, right? That is we call underventilation, right? Overventilating means too much breathing, too much faster breathing right now. That is overventilation, right? So second question, when you ask your brain at that time, when you enter practically in someone's life, you see a patient in front of you, after you see if this is a lung related issue or not, if you think it's yes, then it's respiratory. Then the second question you ask your brain, is it underventilating or is it overventilating? If you think if it's underventilating, remember, if you think it's hardly breathing right now, then you think it's acidosis happening right now to the patient, right? Acidosis, something acidosis related happening right now, and that makes the things further worse, right? So that means your patient is going into respiratory acidosis, right? If you think that this is the overventilating right now, that whatever is happening symptom right now to the patient, and you think it's overventilating right now is happening in there, then you pick in that case is the alkalosis. Alkalosis, right? First of all, I will explain this whole formula in the whole screen. Then I will address each and every single question, whatever the doubt is coming right now on the screen, because we need to finish the formula first and complete the formula first. Okay. So first formula is, as I said, when you enter in someone's room, see if the patient is having the lungs related issue right now, right? If you think it's a lung related issue right now, then you think it's the respiratory problem, right? Then after that, ask yourself, oh, is my patient is underventilating or overventilating? You think it's underventilating? Acidosis. You think it's overventilating? Alkalosis, right? Now, this is the first part. Now, the second thing is, what if it's not a lung related symptom? Maybe any other symptom, but not lung related symptom. Then in that case, you think it's the metabolic is happening, right? Because if it's not a respiratory, then definitely this is metabolic, right? Then after that, once you know this is metabolic, then ask yourself, if the patient has any of these symptoms, like too much vomiting, too much vomiting or prolonged vomiting, your patient is vomiting since very long, right? Or have a too much content into there in the vomiting, too much stuff in there, right? So if you think if the patient has a too much vomiting or too much suctioning as well, then yes, pick in that case is alkalosis. Alkalosis. Why alkalosis, everyone? Because your patient is losing acid right now out from the body, right? So what's left inside? Alkalosis in that case, right? So if it's not a lung, then this is metabolic, right? And if the patient has too much vomiting or prolonged vomiting on suctioning, you think about the metabolic alkalosis is happening in there. But what about your patient is definitely metabolic, means it's not a lung, but no symptom of vomiting or suctioning right now, right? Or never ever right now, since until right now in there. Maybe something else is going on, but it's not a lung related issue at the same time. Then obviously you whatever is left, this is the metabolic what? Acidosis, right? That means if no symptom related to vomiting or suctioning, but of course something around the metabolic, because it's not a lung related issue, then definitely whichever is left, which is the metabolic acidosis, that means the patient is going into metabolic acidosis right now in that stage, right? And the last thing what I want to say in here is, this is only for your exam purposes, everyone, right? The last line which I'm going to say, right? And you only apply this last line if you think you cannot solve the question in your exam, okay? Then you only apply this trick. First of all, use the knowledge, but if you cannot see the knowledge part is in there, then definitely apply this last one, right? When you don't know the answer in the exam, what to pick in there, and you still have to pick up the guess answer, then I would say the guess answer you want to pick up is the metabolic acidosis, especially if someone going for NCLEX examination. Okay. You see, like, I don't know what's going on in there, but no vomiting, no suctioning. Like, I don't know what's going on. It's not something lungs related right now. I don't know what answer to find out. I want to make the guess answer in here. If you want to find out the guess answer in your exam, then you pick metabolic acidosis in that case, because majority of the symptom will cover under here, right? Now, this is only you apply if no knowledge you can recall in the real test, maybe you forget about the stuff, right? But otherwise, if you can recall it, go with that first in that case, okay? Now, this is about the concept until in here. Now, let me see here. Under ventilating, the patient will have the acidosis. Yes, that's correct, Fayaz. Under ventilating means the patient will be into the acidosis. Over ventilating means alkalosis. Over means too much breathing. Faster breathing means it's upper symptom. Upper symptom. So if the patient is going in the upper symptom, that means the pH is going on the higher side. But if the patient symptom is on the downside, this is the underventilating is a down symptom, you look at the acidosis in that case. Very good, everyone. I can see everybody is participating. Very good. YouTube students, I don't see any questions so far from you guys. I don't see much participation from YouTube students today. Maybe type something if you're understanding, not understanding, you have any doubts, any question for me, because you really need to get the benefit out of this class, everyone. The purpose is not just the listening here. You need to apply everything into here so you get the most out of it, right? Now, it's the best time of the lecture today. I think everybody wants to do the practice questions at the same time, and they want to understand how to apply this into the questions, right? I bring some easy question and also some difficult questions the more you go further. Okay, so this is the first question on the screen. Very easy type of question, right? You look at the keywords here. The keyword I see, NG tube feeding, that is attached to the low suction, right? And the nurse monitor the client for the manifestation of which disorder the client is at risk for. You know, you recall your notes, ask yourself, NG, suctioning related. Have you read somewhere? Is it respiratory or is it metabolic? You will be like metabolic. This is not a lung related issue, right? So this is the metabolic, right? And is this the acidosis? Or is this the alkalosis? You will be, this is the alkalosis. Why alkalosis? Because I just mentioned in the previous slide is patient is losing the acid in that case. That means your patient is going into alkalosis. Very good, everyone. So the right answer for this question I can see here is the number 2, metabolic alkalosis. Very good, everyone. Ventilator, we're gonna cover Ramandeep in the respiratory class. I will bring the ventilators as a separate in there. After the finishing cardio, I'm gonna take everybody test on endocrine system. Then we will move on to the respiratory system also, where I will discuss the ventilator systems also. Okay, so that is a separate topic for sure. But stay tuned. Everybody can stay always update on my channel. I will bring it for sure because it's also one of the important topic if you're writing especially for the NCLEX or NORCET exams, right? Now, let's see the next question, everyone. I think this is one of the easiest question I can see everybody answer it. Let's try this question, everyone. Who want to give me the answer for this question? Compensated, uncompensated, related. First of all, look at what they give you in the question. You know, they give you the pH value, they give you bicarbs, they give you the carbon dioxide too. But you know that you have to look the pH and bicarb first to find out if this is the metabolic or if this is the respiratory. The pH is on the upper side, right? The bicarb is on the lower side. They are both not in the same direction. That means this is the respiratory. Now you have two respiratory here. Now which one? Acidosis or alkalosis? You look at the pH. The pH says what? Alkalosis. You already find out the answer, right? Because there is no other option with that. Now this is the compensated one. Why this is the compensated one? Who want to tell me the answer? Why this is the compensated one? Let's see here. Why this is the compensated? Normal pH. Very good, because pH is normal here now. Very good. Back to there. Very good. Very good. See, you find out the answer. Now let's see the next question on the screen back again. Another easy type of question for your exams, right? They already tell you in the keyword, the client is experiencing respiratory acidosis. So respiratory acidosis. How do we know which one is respiratory acidosis? So first thing, respiratory is what? pH and bicarb is opposite, right? pH and bicarbs is the opposite in that case, right? But here, I don't see that actually in there. When you look at the options in here, you are like, oh, they give you pH and PaCO₂ only, right? Now you think from here, acidosis, right? Which one is acidosis in here? I think everybody going to find out the answer right away, because you eliminate, you use elimination process. You find out your answer right away then. Okay. Very good, very good. I can see answer is 1. Everybody pick up the answer is 1, because you use the elimination process and you just find out the answer right away. Very good. If someone has a long doubt, long question for me, try your best to type in the messages first. What exactly doubt do you have? Because sometimes I can address at the same time. But if I'm not able to answer it, sometimes I don't understand your question, then I will open up your mic. Okay? Now let's see the next question in here. The next question, I can see it's a SATA question example, right? The SATA question they give you, the nurse notes that the client ABG value here is what? pH is 7.50. You think about the alkalosis. Oh, alkalosis means upper side. Yani ki patient body is on the upper side. You want to look at the symptom on the upper side, right? I already give you guys a clue. And you also don't forget to apply the good idea, bad idea, right? You think it can be there, it cannot be there. Good idea, bad idea, right? Those students who know me the SATA questions before rules, they give you PaCO₂ values as well, right? And now they wants to know the nurse monitor the client for which clinical manifestation here, like a symptoms. Try your best to pick up the answer. Then I'll tell you the my answer keys at the same time as well. Okay. Usually everybody pick up, I can see 2, 4, 1, 4, 5. So when you say 5, I can see this person is Atif, right? It says hyperkalemia, right? So you remember potassium is the exception in that case, right? No worries. Yeah, and type your doubt for me so I can see what kind of question do you have before I give you the mic, right? Okay, I can see other doubts is here is the confusion, tachycardia, lightheadedness. Very good, everyone. Very good, very good. So first is nausea. Nausea. Nausea is kind of sickness kind of symptom. You know, person is not feeling well. Good idea, bad idea in alkalosis. I would say good idea. Why not? Right? Confusion. Confusion is also, you think, in the form of upper side or lower side. I would say upper side, neurological symptom, you know. How come your patient is getting into the confusion now, right? So I will keep the second option in. Then you think about bradypnea. Oh, this is a lower symptom. I want to think about the upper symptom, right? So this is not the one. And then you have tachycardia. Yes, upper symptom for sure. You want to think about it too. But when you remember your formula, they say except potassium. So it should be hypokalemia, not a hyperkalemia. So I will take this option out. Then after that, they said lightheadedness. Why lightheadedness usually happen? I would say it's usually happen because of changes in your blood pressure, right? Then you ask yourself, when someone is alkalosis, that means they are usually hyperactive, irritated, restless, right? Then you ask yourself, like, is this possible? You know, lightheadedness in that case, right? Good idea, bad idea, right? So what do you guys think now? Lightheadedness, should I keep it in or take it out? What do you guys think? Lightheadedness, should I keep it in or take it out, everyone? You want to keep it in or take it out? Anyone? Okay. I would keep it inside in here. This one answer is going to be in. Because lightheadedness can also be possible with the low blood pressure. Lightheadedness can also be possible with the high blood pressure as well. So this is just a general symptom. I would keep it in. Now someone asked me a question here, ma'am, why nausea could be the answer is inside in here. So basically, when the patient is in alkalosis, it just disturb your stomach, your GI stuff, your electrolytes at the same time inside the body, and that triggers the nausea in someone, right? So this is the exactly main answer why I want to keep the nausea inside in here. So I hope everyone understand this question as well. I can see majority of them, they pick up the right answer in this case on YouTube and also on the Zoom lecture, right? Let's try another more question. We are almost done for today's class. Let's try this question with me. This is little bit your NGN style question. They're going to give you lab value in the case studies, right? And they want to know what exactly does it look like, right? I think everybody can see the pH now, right? And they think about the bicarbs now. Now see everyone, here they already give you the normal is until 28, right? In the exam perspective, you always look at the case study. In the case studies, they always give you normal values. So if they already give you 28, then you think about according to 28, right? Now you see in here and tell me the answer. What do you think? Okay. Respiratory alkalosis, number 4. Very good. Everyone, respiratory alkalosis. Very good, very good, very good. I can see number 4, everyone is picking up the right answer here so far. Very good. See, so when you have these type of question in case study also, don't get confused. Just look at the values and then apply the same steps. Okay, that will help you to find out the right answer for sure. Another last question with me before you leave, a little bit tricky because in this question, they are demanding the nursing intervention actually, right? Now, again, you look at the values in the question, what they give it to you, and then read the question. The question says the nurse reviewed the lab results here from 9 o'clock in the morning. Your patient is actually with the heart failure who is intubated and mechanical ventilated already. Okay. And they want to know which of the following intervention does the nurse anticipate? Something you are anticipating at this time to correct this acid-base imbalance. Use elimination method. You will go and find out the answer. Okay, try your best. Then I will solve this question for you also. It's a little bit harder level question. Just try your best. Okay, I can see majority of them, they are picking up the soda bicarb now. Okay, other students, let's try to find out the answer. Then I'll give you my answer key. If you're not sure, maybe just type you're not sure. Just try your best. Okay, some students pick up 4, some students pick up 3. Yeah, COPD patient can also have a normal pH too. They can get back to fully compensated as well. That's a doubt by someone. Okay, don't know, not sure. Okay, let's see how to do this type of question now. So here, first of all, look what is exactly happening in here, right? In the question. So you have the pH is on the lower side or on the upper side? I would say this is on the upper side, right? That means this is the alkalosis for sure. right? So first of all, you know this is alkalosis for sure, right? And then you have the bicarbs is 27 on the normal side, a little bit, right? So I would say this is still respiratory. Why? Because at the same time, when I see why there is less CO2, the normal is like 35 to 45. That means the carbon dioxide is less inside the body. That means your patient is hyperventilating at the same time. Why too much CO2 the patient is giving outside? The body has a less CO2 inside is in here, right? So I would say this is a respiratory problem, first of all. So respiratory alkalosis now. Now, once you know this is the respiratory alkalosis condition, you look at each and every single option. The first one says administer furosemide. Furosemide is what? Diuretic, right? This is your loop diuretic. If you remember my previous class on the cardio, right? So diuretic basically treat the fluid overload for sure in the heart failure, right? Because we want to prevent the pulmonary edema and hypoxia as well. But the oxygen level, if you look at here, they give you between normal value is 80 to 100, they give you normal, and you have a 95 here, right? So this is normal, right? And I don't think so administering the furosemide will correct my patient alkalosis, right? So this is something I don't want it, first of all, right? And then you look at the next options. The next option you have is the decrease the set respiratory rate because your patient is on ventilator. Do we need to decrease it or not? Because your patient is too much hyperventilation right now. How do you know too much hyperventilation? Because CO2 is already less inside the lungs, right? So if I use this option, number two, that means if I decrease my ventilator respiratory rate setting, that means it can help the patient retaining little bit carbon dioxide back again, and it can correct also alkalosis as well, right? So I will keep this option in for now, right? And compare it with the next one. The next one you have is the administer the soda bicarb. Soda bicarb is an alkaline itself, right? So if you give this patient, this patient is already in the alkalosis, so you're going to make in the worst because soda bicarb is already alkaline in nature, right? Those who have no knowledge about it, that's okay. Remember for next time, soda bicarb is already alkaline itself, right? We give soda bicarb in the acidosis, metabolic acidosis, because you want to increase the pH in that case, right? So this is not the answer for sure, right? Now you compare between 2 and 4. The 4 says perform endotracheal suctioning. So if I do the suctioning, that means it's going to remove the secretions. That means it's going to improve the oxygen. It can improve the acidosis, right? But this patient is what? This patient is in the hyperventilation right now, alkalosis right now, too much hyperventilation if it's happening. Do you think suctioning will help you in there, right? The answer is not, right? Because it cannot correct the alkalosis, which is caused by the hyperventilation, right? It can definitely help in the acidosis patient who are not breathing enough. But here, oxygen is already fine. So I don't need to do the suctioning also in this case. That means my only left answer is decrease the set respiratory rate. This is one of the difficult question, and the reason why to bring this type of question. So you can see actually, every type of question with me in the acidosis and alkalosis, right? And you can see how to apply these type of knowledge in the different questionnaires as well, right? So I hope everybody liked the class today, learn a little bit something about acidosis, alkalosis, and everything. In this month, I'm bringing a lot of lectures on the question practice using strategies, less knowledge, more knowledge, all those tricks I will bring it up, right? Make sure you do stay connected with me all the time to watch out all the announcement when it's going to be the next class, right? I will post out another announcement today for the fluids and electrolytes. So stay on with me. on the WhatsApp channel everywhere. If anyone still has any doubt, any question for me, you can definitely ask right now if you have any question. Those who still want to learn something in Hindi language, I speak Hindi and Punjabi also. You can always connect with me on the WhatsApp and I will try my best to explain you the way you can understand. Okay. So thank you so much everyone for joining the class today, right? I will post out the information today on the WhatsApp. Stay connected with me for the next classes in there. And we'll see you guys for the next class. You take care and enjoy your weekend. Thank you. Bye, everyone. Thank you. Yeah.